Welcome to the channel MedBro. Today we will try understanding about coma. Have you ever wondered what happens to a person in a coma? What changes occur in their brain? Coma, a state of prolonged unconsciousness, is a profound medical condition that has intrigued and challenged medical professionals for centuries. At its core, a coma signifies a severe impairment of brain function, and the reasons for this can vary greatly. Some may be due to diffuse brain dysfunction, a condition where damage is spread throughout the brain, disrupting its normal activities. Others may be a direct effect within the brainstem, the part of the brain responsible for basic life functions. Still, others may be due to pressure effects on the brainstem, where swelling or a mass exerts pressure, compromising its function. Over the next few minutes, we will delve into the mechanisms, causes, and effects of coma, providing you a comprehensive understanding of this complex and critical medical condition. To understand a coma, we first need to understand its mechanisms. Let's start with the brain. It's a complex organ acting as the control center for all of our body's functions. Consciousness, the state of being aware, awake, and responsive, is maintained by the brain's intricate network, with a vital role played by the brainstem. When this network is disrupted, it can lead to a coma, a state of prolonged unconsciousness. The brainstem, a small but essential part of the brain, is responsible for regulating our most basic life functions, such as breathing, heart rate, and wakefulness. It's like the brain's power switch. If it's functioning properly, we're awake and aware. If it's impaired, consciousness can be lost, resulting in a coma. There are two main pathways through which a coma can occur: diffuse brain dysfunction and direct or pressure effects on the brainstem. In diffuse brain dysfunction, widespread brain damage or dysfunction occurs. This can be due to various causes like lack of oxygen, toxins, or metabolic abnormalities. The damage is spread out, affecting large areas of the brain, disrupting the normal functioning of the brain's network, and leading to a loss of consciousness. On the other hand, direct effects within the brainstem or pressure effects on the brainstem are more localized. This could be due to a tumor, stroke, or brain hemorrhage that directly affects the brainstem. This direct impact or pressure can cause the brainstem to malfunction, disrupting its role in maintaining consciousness. It's like a complex electrical circuit. If there's a widespread power outage or a significant issue at the power station, the lights go out. Similarly, in a coma, either widespread brain dysfunction or direct damage to the brainstem can cause the lights of consciousness to go out. Now that we have an understanding of the mechanisms, let's move to the causes of coma. There are numerous causes that may lead to a coma. Some of them might surprise you. Now let's delve into the reasons that could potentially plunge a person into this deep state of unconsciousness. Injuries, such as severe head trauma from accidents or falls, can cause swelling or bleeding in the brain. This trauma can result in a coma. Tumors, too, can lead to coma. When a tumor grows in the brain, it can press against vital areas, disrupting their function and causing a person to slip into a coma. Infections such as meningitis or encephalitis can also cause inflammation in the brain, leading to coma. Even systemic infections like sepsis can result in coma if they progress unchecked. Metabolic problems such as a severe drop or rise in blood sugar or sodium levels can disrupt the brain's function, causing a coma. Drugs and alcohol, too, can lead to a coma, especially when consumed in excess. The substances can suppress vital brain functions, resulting in a state of unconsciousness. Conditions such as stroke or heart attack, which cut off oxygen supply to the brain, can also result in coma. Causes of brain diffuse dysfunction may include drug overdose, CO poisoning, hypoglycemia, hyperglycemia, hypoxic and ischemic brain injury, hypertensive encephalopathy, uremia, hepatic failure, electrolyte imbalances, endocrine causes, metabolic acidosis, trauma, epilepsy, subarachnoid hemorrhage, and cerebral edema. Causes of direct effect within brainstem may include brainstem hemorrhage or infarction, brainstem neoplasm, brainstem demyelination, Wernicke-Korsakoff syndrome, and trauma. Causes of pressure effect on brainstem include hemisphere tumor, infarction, abscess, hematoma, and cerebellar mass lesions. Identifying the cause of a coma is crucial, as it directly influences the treatment plan. It's a bit like detective work, piecing together the clues to solve a mystery. But how do we examine a patient in a coma? Examining a patient in a coma is a careful and meticulous process. It starts with immediate assessment, taking note of the patient's appearance, breathing pattern, and any obvious signs of trauma. The general examination follows, where we observe for signs like temperature variations, cyanosis, jaundice, petechia and purpura, hyperpigmentation, injection marks, any coarse or dry skin. Look for smell of ketones, alcohol, or ammonia. Arsenic poisoning produces kerosene smell. Cheyne-Stokes respiration is alternating hyperapnea and apnea seen in bilateral cerebral dysfunction or brainstem problem. It also occurs in metabolic comas and respiratory failure. Kussmaul respiration is deep, sighing hyperventilation seen in diabetic ketoacidosis and uremia. Next, we step into a neurological examination. The patient's head, neck, and spine are examined for any signs of injury or abnormalities. We then look at the pupils. Are they equal and reactive to light, or is there anisocoria? Bilateral fixed dilated pupils are seen in brainstem death and deep coma of any cause. The fundi are examined for papilledema, hemorrhages, or exudates, which could indicate increased intracranial pressure or other issues. Ocular movements are studied for nystagmus or abnormal conjugate gaze. Passive head turning produces conjugate ocular deviation away from the direction of rotation like Dahl's eye reflex. This reflex is absent in deep coma and brainstem lesions. In caloric stimulation test, ocular deviation towards the integrated ear is seen when ice-cold water is irrigated into external auditory meatus. This is also present in brainstem death. Other findings might include facial asymmetry, abnormal posturing, or reflex changes, but we don't stop there. The cardiac examination is crucial, as heart conditions can often lead to comatose states. We listen for any irregular heart rhythms, murmurs, or signs of heart failure. The abdominal examination follows next, which can reveal signs of liver disease, kidney failure, or other systemic issues that might have triggered the coma. Immediately after this, we carry out the respiratory examination. This is vital, as it can help identify any breathing difficulties, lung diseases. Each of these examinations is like a piece of a puzzle, providing us with valuable clues about what's happening inside the patient's body. By putting these pieces together, we can start to understand the cause of the coma and formulate a treatment plan. Yet, let's be clear. These examinations, while critical, are just part of the diagnosis process. Investigations like blood tests, imaging studies, and perhaps even a lumbar puncture play a significant role too. They help us confirm our findings, rule out other conditions, and monitor the patient's progress. So while the examination of a coma patient is indeed a detailed and careful process, it's part of a larger, comprehensive approach to diagnosis and treatment. Examinations provide us with crucial information, yet they are just part of the diagnosis process. Investigations play a significant role too. Investigations are the next step in the process, helping us confirm suspicions and guide treatment. The most common tests include imaging studies like CT scans or MRIs, which allow us to visualize the brain and identify any abnormalities. Blood tests can reveal critical information about the patient's overall health, such as electrolyte imbalances or signs of infection, both of which could contribute to the coma. Routine biochemistry like urea, creatinine, metabolic and endocrine studies like TSH, serum cholesterol are recommended. Urine examination for ketone bodies, arterial blood gas analysis, CSF examination may be recommended. In addition to these investigations, there are a plethora of other tests that might be used depending on the suspected cause. Lumbar punctures can be performed to check for infections in the brain or spinal cord, while an EEG, or electroencephalogram, can be used to monitor brain activity. Once we've identified the cause, we can start on the road to management and treatment. This typically involves addressing the underlying issue, whether it's an infection, a tumor, or a metabolic disorder. In some cases, medications may be used to control seizures or reduce brain swelling. If the cause is a brain tumor or bleed, surgery may be necessary. However, it's not just about treating the cause. Coma patients also require comprehensive supportive care. This includes maintaining their airway, ensuring adequate hydration and nutrition, and preventing complications like bed sores and infections. Remember, each patient's journey will be different depending on their unique circumstances. The goal is always to support the patient's bodily functions while their brain recovers. Investigations and management are key to a patient's recovery, but what about the general measures? Aside from medical treatments, general measures play an essential role in a patient's recovery. These general measures aren't just about maintaining physical health, they also serve to preserve the dignity of the patient, even when they aren't conscious. Oral hygiene, for instance, is something we may take for granted. However, for a coma patient, it's a crucial aspect of care. Regular mouth cleaning can prevent the buildup of bacteria, which could lead to infections affecting the patient's overall health. Eye care, too, is essential. Regular cleansing of the eyes and the use of artificial tears can prevent dryness and potential infections. It's a small act, but it can make a significant difference in the care of a coma patient. Nutrition and hydration are also vital. Even in a coma, the body's basic needs must be met. This is where the Ryle's tube comes in. It's a thin tube passed through the nose into the stomach, allowing for feeding and medication administration. It's a lifeline, delivering essential nutrients and medicines directly where they're needed. Then there's the urinary catheter. It's used to drain the bladder, a basic function that a coma patient cannot control. The catheter helps to maintain hygiene and comfort and monitor the patient's fluid balance, which is crucial in assessing their overall health status. All these general measures might seem basic, but they're fundamental to the patient's well-being. They ensure the patient's body keeps functioning while the medical team works tirelessly to bring them back to the world of the conscious. Understanding coma, its causes, effects, and management is crucial in medical science. It helps us not only in treating patients, but also in unraveling the mysteries of the human brain.